Good evening, everyone. We're going to go ahead and get through some announcements. Welcome to the Thursday lecture Zoom class. Every Thursday, we have a lecture at 4 p.m. So please remember on Thursdays, every Thursday for 4 p.m., unless it's a holiday, unless we're off, we have Zoom class, which is our lecture. Remember, when you do log on, you will receive extra points for joining our lecture, and you can apply those points to assignments, exams, or labs. So just remember to make sure that you keep account of your points. Keep the date that you were on the lecture, and it depends on what we're reviewing, if it's 5 or 10 points that you will receive for extra credit. You can use those, you can hold those points until the end of the module. And if you want to apply it to like that last assignment, or if you want to apply it to assist with a grade, say for instance, you made a 70 or you made a 65 and you had like 20 points, and you want to apply that to your exam to boost your grade, you can do that as well. So please make sure, like today is May 18th. Write that date down with your name, and then I'll let you know the points that was received for this video, for this lecture class. So please try and keep count. I have it as well, but it's for you as well to keep count in case I might forget to put your points down. So just keep count of your grades that you receive, your points that you receive. Also, please read your emails daily. Read your emails every day when you log on and before you log off for the day. Please check everything in your e-learning. Check your news and announcements. I did post an update in news and announcements today in reference to a guest speaker for career services. It's May 31st for 3 p.m., which is a Wednesday. They're going to have a guest speaker on nailing the interview. So it's going to be a guest speaker telling you on different techniques on how to apply and strategies when you're interviewing. So please make sure that if you can attend that on May 31st for 3 p.m. The link is in news and announcements in the grade section of e-learning. It's labeled news and announcements. Also, in reference to your assignments for my new students, you are to start on day 3. Day 3 is where you start. Your first 2 grades are dropped in your grade book. Before you had a 0, those grades have been dropped. And if I haven't dropped them, just let me know. You're not responsible for day 1 and day 2 daily assignment. You're not responsible for those grades, and you're not responsible for that pretest that was also in the assignments. You will start on day 3. So just remember that you are to start on day 3 assignments. Also, remember when emailing me or texting me, please, try your best. I allow texts up to 8 p.m., but my business hours are Monday through Thursday, 8 to 5 p.m., and on Fridays, 8 to 4. If you do text me, I will respond up until 8 p.m. I will not accept any text messages or respond to any text messages after 8 p.m. So keep that in mind. I do have other classes. This is not my only class. I have 5 other classes that I am teaching, regular classes plus independent study classes. So please do not text me after 8 p.m. If you email me at that time, I will respond to emails up until 8 p.m. and the next business day. But remember, I have 24 hours, and that's also in the welcome. It has my business hours and the time that I have to respond to emails. Like I said, I have 5 classes that I am teaching. So it takes time. I cannot respond at the minute of every class. Right when you text me, I might not be able to respond because I might be on the line with another student. So please take into account all of those things, but please do not text me after 8 p.m. That's already, I work from 8 to 8. My hours are 8 to 5, but I do extend because I know students are working. I know that people have families, they have children. So I do allow extra time that I'm not being paid for as well until 8 p.m. So please be mindful and considerate of that. On Saturdays and Sundays, I do not respond to emails, and I do not respond to text messages on the weekend at all. So please be mindful of that as well. If it's an emergency, please text me or call me if it's an emergency. But if it's an assignment related question, please do not text or email me if it's related to an assignment. That is not an emergency. Assignments can be reopened at any time. I can reopen assignments if you need them to be reopened. So please do not text or email me any questions. You can email me on the weekends, but not texting me any email related questions on the weekend. I will not respond. So we're in the, I'm going to share my screen now. So in news and announcements, it's in the grace section. I want to go over this, especially for the new students. Still having trouble with this email. This mouse. So in news and announcements, here as well, and this is your grace section of e-learning. So you have the welcome, which is here. This is your class expectations and tips for success. And it also has my business hours, do not contact on weekends. And here is your book. The book that we're using, and it has the start date of the class and the end date of the class. You can find this in the welcome. This is the book we're using, the Administrative Medical Assistant, and I will also show you in the ebooks, the white paper-like book we are using for the workbook. The workbook is the white paper-like book. It looks like a white sheet of paper, but it says the study guide for the Administrative Medical Assistant. Next, we have, once we go through that, the grace section, we have our news and announcements. This is where I have placed the information on Wednesday, May 31st for 3 p.m. It's called Nailing the Interview. We have a guest speaker. And remember, it says on here, it is mandatory that each student participate in 4 seminars. Mandatory. And it says, hello students, Career Services is hosting an event on May 31st at 3 p.m. We encourage students to participate in this event regarding nailing the interview. It is mandatory that each student participate in 4 seminars before completing their program. So please make sure that when we have things that's going on and it's asking and it's telling you it's mandatory, make sure you keep a record of what you're participating in. 4 seminars you have to participate in before completing the program. The link is included in news and announcement in this email. You just have to press, if you don't see the link when you click on it, it says read more, click on that link. Your syllabus. Your syllabus is in this grace section. If you're having difficulty trying to understand what's going on, here are the objectives on what lesson we're in now. Lesson 1, the professional medical assistant and the healthcare team. Your assignments, it has on the one you had, discuss the typical responsibilities of a medical assistant and describe the role of the medical assistant as a patient navigator. Majority of these questions and assignments in your daily and your lab, they're in your PowerPoint slides, which we will review. Zoom class. Here is your Zoom class. This was the last class that we did prior. It was 158, and it was explaining which module we were going to be going into, and I also placed it in the last module we were in. So here is your Zoom class, and once we complete this one, it will be in that class as well. So once we complete this session, it will be uploaded and placed in your Zoom class. Next, we have your PowerPoint slides. It's also in your e-learning of the grade section, your e-learning, PowerPoint slides. Chapter 1. So here you already have everything you would need to know in your PowerPoint slides. It's going over the professional medical assistant and the healthcare team. The objectives that will be covered. I discussed most of these in the last slide. So make sure that you're reviewing, that you're looking at the objectives that are going to be covered in this chapter. I went over number 1. Number 2, discuss the attributes of a professional medical assistant, project a professional image in the ambulatory care setting, and describe how to show respect for individual diversity. Differentiate between scope of practice and standards of care for medical assistants. So these are all your objectives, which you can find in your syllabus as well. All of your objectives. Responsibilities of a medical assistant. This was one of your daily assignments. Clinical skills of a medical assistant include assisting during a physical exam, performing patient screening procedures, performing ECGs, phlebotomy, first aid procedures, and infection control procedures. Administrative skills include answering the telephone, managing patient scheduling, documenting accurately in patient health records, managing facility correspondence, following legal and ethical principles. So what do you think they mean when they're saying following legal and ethical principles? Can someone give me some examples of that? What does it mean when it says following legal and ethical principles?
Probably not disclosing the patient's information.
Great, Jasmine. That is definitely the best response. That's the first thing. Confidentiality is the most important thing. Never disclose, because what happens a lot of times, say that you're, that medical assistant or even that nurse, and you're walking down the hall and you're discussing a patient's health information. You don't know who could be in that room that's listening. I might know that person, and you're disclosing their personal health information, which is a HIPAA violation, and you can be fined and sued for that. So always remember, never discuss a person's health information around anyone. Make sure that you're always behind closed doors and that person has signed and you're speaking on behalf of that person with that person who needs to know the information. If they don't need to know that information, you shouldn't be sharing it with anyone. The role of a patient navigator. Medical assistants also play roles as the patient advocate. Care coordination originates from patient navigator program. Patient navigator positions are commonly called care coordinators. So just remember, you're doing medical billing and coding, but also remember you're getting a certification for medical office assistant. So you're going to have 2 different certifications that will be very important for you to also increase in your pay rate, your pay scale, with you being able to negotiate your salary, because you will have all of those different skills. So never limit yourself, and never be afraid to negotiate your salary. Don't just accept that someone is saying, okay, I'm going to give you $14 an hour, and you're like, okay, negotiate. And you know your ability, you know your skill set, negotiate that. We have a student that just started in October who has landed a job in medical billing and coding, and she was able to negotiate her salary, and she has not even graduated yet. And they told her range was between $16 and $18 an hour. They offered her $17 an hour. She just started this program in October, and she has that job. And they told her once she gets her certification, she will get even a higher salary. So always think about your potential. That, your skill set and what you're able to offer. So never just settle for that, like what they're offering. Always negotiate. Say, well, I'm in school. I'm about to finish, or I'm graduating. I'm going to have dual certifications, medical office assistant and medical billing and coding. So you're able to run front office, back office. If they need assistance with coding, you can do all of that. So use that and make sure that you put all of these skills in your resume. You know, put the skills that you've learned, like I said before, with the SIM charting, with the coding, with evaluation and management coding. Don't just put coding. You know how to do outpatient, inpatient, evaluation and management. You know how to do all of those skills, but list those skills in your resume and cover letter, because just saying coding, they don't know what that means. I mean, they know regular coding, but when you can do outpatient and inpatient, hospital and clinic, that's a plus. So always remember to list all of the skills that you're learning and have acquired.
I'm glad I contacted Career Services
Mm-hmm.
because I sent my resume off and they fixed it for me to where it looks much better.
Yes. And that's why I can't stress enough. Career Services, that's their job, to assist you, like that process that's coming up on May 31st, nailing the interview. They're here to assist you, giving you skills and techniques. And like I said, a lot of times we'll put on there medical billing and coding. Medical billing and coding and what? You have outpatient, inpatient. Make sure you use all of your words. Use that verbiage to sell yourself. That's what you need to do, sell yourself. So please, like I can't stress enough, if you're looking for employment now and you need some extra assistance and you want a part-time job or whatever, contact Career Services. If you feel that you're ready to move forward, contact Career Services and they will assist you with employment.
I want to say the place that I applied for, they're full-time, if I'm correct.
Okay.
So I say the hours are from like 8 o'clock in the morning to 7 o'clock in the evening.
Mm-hmm.
So I don't know how I'm going to finagle this, but I'll figure it out.
Yes, but like you'll be able, like I said, that's why, but then just realize that you want to try, and do it. But if that's too long, ask them if it's, they can be flexible because you are in school.
Right.
You have to be willing to negotiate. Yes. So next we have here customer service, which is very important. Medical assistant must provide excellent customer service. Customer is one who purchases goods or services. Patients are considered external customers. Internal customers, people whom you deal with in the work environment. Customer service, whatever we do for our customers to improve their experience. Characteristics of professional medical assistant. This was one of your daily assignments. And look at this. The answers are right here in your PowerPoint slides. You have to read your PowerPoint slides. You have to read your chapters. Characteristics of professional medical assistants. And remember, you all have an exam today. Not the new students. You're not responsible for this exam, but our current students are responsible for this exam, and it's due by Sunday. So please do not start an exam if you're not going to finish it the same day. You have until Sunday to complete the exam. Today is the exam, but you have until Sunday to complete your exam. And then make sure, it's open book. So it shouldn't be any reason that students are failing an open online exam. That means that you're not reading. You're not studying.
I kicked myself in the butt for missing one question on my last one.
One is okay, because it can be some tricky questions and you have to read through it. But your answers, if you're reading in your chapters and the questions that they're answering, like this is one of your daily assignments. Characteristics of a professional medical assistant: professionalism, courtesy and respect, empathy and compassion, tact and diplomacy, respect for individual diversity, honesty, dependability and responsibility, professional appearance. That was one of your daily assignments. And believe it or not, I had some answers that were not accurate. So please read your PowerPoint slides, read the chapter, which we will be going in the book in a few. Scope of practice and standards of care for medical assistants. That's one of your daily assignments. It's here in your PowerPoint slides. Scope of practice. range of responsibilities and practice guidelines that determine boundaries with any healthcare work or practices. Medical assistants are not independent practitioners. Medical assistants not meeting expected standards of care may be charged with professional negligence, as well as medical office assistants and medical billing encoders. Standards of care, that definition is legal term that refers to whether level and quality of patient service is same as what another healthcare worker with similar training and experience in a similar situation would provide. Professional organizations for medical assistants: American Association of Medical Assistants, AAMA, American Medical Technologists, the acronym is AMT, National Health Career Association, NHA, not involved in program curriculum standards or program accreditation. Achieving a credential and continuing education, you all can read on that part. I'm not going to go too much in detail for that because you're in medical office assistant and medical billing and coding. This is important. Study skills, trick for becoming a successful student, memory techniques, active learning, brain tricks, reading methods, note-taking strategies, come to class prepared, request copies of slides before a lecture, create mind maps. So slides before a lecture, I post all of your PowerPoint slides for you. I added it in so that you all would have that available for you, your PowerPoint slides. So now we're going to go into the book so I can show you the books that you are using. This is like all of your PowerPoint slides. So read through your chapters 1, 2, 3, 4, 5, 6, and 7. Read through those chapters. I'm going to go into the actual book that we're in. I just want to pull this down. So for the assignment for tonight, this is the skills and concepts. Skills and concepts. Let me go to the actual book. This is the study guide book. You know, you go to ebook library. Taking a long time now. So this is the white paperback book that I'm telling you all about. And it says Study Guide and Professional Checklist Manual for KENS, the Administrative Medical Assistant. This is your lab book. That's why when I said a white like sheet of paper, but it is a book. This is your lab book. Your skills and concepts, I'm gonna go back. This is the assignment for day 4 for your labs. Skills and concepts, A, B, and C. A starts with Introduction to Law, B, Sources of Law, and C, Criminal and Civil Law. Prior to that, you had your vocabulary review, which started with group A, which was assigned in a previous assignment as well. But if you didn't get a chance to complete it, you still would need to know these vocabulary words because this is included in your exam as well as your final exam. So it's good to make sure that you complete this assignment as well. This is vocabulary review, chapter 3, legal principles. This is the workbook. This is your lab book. And it has group A, Group B, and Group C.
I got confused for a minute.
So what did you get confused on?
I was looking at it and I was like, why are we in chapter 3? But then I realized I'm ahead of the new students, so. So
Yes. Yes, but the new students will start on day 3.
And I think I'm starting on day 5.
Today is day 5's assignment.
Yeah. Which I got confused on that too, because I didn't realize that the exam was today along with the assignment, because I looked and I was like, where's lab 5? And I was looked up and I was like, oh, yeah.
So today, you remember, see, this is where the confusion came in. Day 1 started on Friday of last week.
Right.
Day 2 was Monday. Day 3 is Tuesday. Day 4 is Thursday. So today is actually day 4. Friday is day 5.
Oh.
So day 1, Friday. Day 2, Monday, I'm sorry. Day 3 is Tuesday. Day 4 is Wednesday. Day 5 is today, Thursday. Day 6 is tomorrow.
Okay. But day 5 lab, we don't have anything to turn in, right?
No.
It says, oh, okay.
Yes. Yes. So you remember the exam starts today because it's day 5. That's the exam, but it's not due until Sunday. But do remember, if you start it today, you have to complete it today. You cannot start it and then stop and then go back and then come back, because then that's not fair to everyone else, because then you're able to go back and look and get more answers. So if you start it today, you have to complete it today. It is 49 questions, because remember, it's chapters 1 and 2. It's 1 and 2. So today we're starting on chapter 3, which is legal principles. Legal principles is what we're starting in today.
And see, another thing that happened was on Friday, they wouldn't let me into the course until 11:55 that night.
Yeah.
I changed it. The system did that. I changed it so everyone can go back and complete that day 1 assignment.
Okay.
It will be open if it's not open, because I opened it, but then people still didn't complete it, and it closes once you don't complete it when it's reopened. So I'll go back. So please watch this recording. For those of you who are not here, I want you all to know I will reopen day 1 assignment for those who did not complete day 1 assignment. If you're unable to upload it in your comment section or in the regular upload, please email me your day 1. Please email your day 1 assignment. But remember, today is the first day of chapter 3, legal principles.
Okay.
Today is day 5. So this is the book. I just want everybody to make sure that they know this is what it looks like. Study Guide and Procedure Checklist Manual for KENS, the Administrative Medical Assistant, 14th edition. It's a white, like I said, it looks like a sheet of paper, but it's your actual book. And in chapter 3, it gives you study hints for all students, class notes. It just tells you on how to go about your class notes. And it goes on here. Chapter 1 was the professional medical assistant in the healthcare team. So for my new students, if you would like to go back and read the chapters, go through your PowerPoint slides, because it's a summary of everything. Each PowerPoint slide. Chapter 1, chapter 2 was therapeutic communication, and chapter 3 is legal principles, which start on page 47. And like at the bottom, you can see on how I'm turning the pages at the bottom on the arrow. Chapter 47, well, page 47. This is a checkoff list that they're showing for us. And these are things that will be at the end of your exam, like procedure to demonstrate respect for individual diversity, religion, and appearance. And they'll have your name, and you're going to be having some guidelines, whereas I'm going to send some questions to you all, and you all will have to communicate with each other through the discussion panel. So that'll be part of the exam as well. So now I'm going to go to the actual book. I'm going to go to the actual book. This mouse, let's see, here we go. And here is the actual book. It's the orange, green, yellow swirls. Here's the actual book. Health Insurance Essentials. And this was your vocabulary in your textbook. Your ebook right here was the vocabulary. Make sure that you become familiar with the vocabulary. They give different scenarios to be able to assist you on how you respond. And they give you different things that you would need to know while studying this chapter. Think about the following questions. So this is the beginning. We're past this now. We're in chapter 3. This was just an introduction for my new students who would like to go back. For the medical students, when you're looking at this information, health insurance plans. There are 2 types of health insurance plans in the United States. That's a test question that's going to be on your final as well. Government health insurance plans and private health insurance plans. So these are some things that you might want to highlight in your book when you're going through it. 2 types of insurance plans. There are only 2. Government health insurance plans and private health insurance plans. And it tells you health insurance plans typically cover health services and procedures that are deemed medically necessary. Medically necessary services are those that are necessary to improve the patient's current health. Most insurance policies do not cover elective procedures. Elective procedures are medical procedures that are not deemed medically necessary, such as a facelift or another cosmetic procedure. So a lot of insurance plans, they don't cover anything cosmetic unless it was due to something like with cancer and breast cancer. And they might also, to say do augmentation and things like that. But things that are not medically necessary, your health insurance will not cover. Preventive care services. You all need to know these preventive care services, especially with medical billing and coding. Alcohol misuse screening, these are all preventive care services. Blood pressure screening, cholesterol screening, colorectal cancer screening, depression screening, diabetes type 2, diet counseling, hepatitis B and C screening, human immunodeficiency virus, HIV screening, immunization vaccines, lung cancer screening, obesity screening and counseling, tobacco use screening, sexually transmitted infections, STI prevention counseling. These are all preventive screenings that you can have taken care of with your insurance that you don't have to pay for. Government health insurance plans. Government health insurance plans provide coverage with reduced or no monthly premiums for the indigent, the elderly, the military, and government employees. Do you all know what indigent means?
It's not having the money to pay for it.
Correct.
Or
Correct. Indigent are those who cannot afford to pay for their medical needs. There are a number of different plans, but patients need to qualify. This is on your exam and your final, so you might want to highlight this. There are a number of different plans, but patients need to qualify by age, income, government occupation, health condition. A patient who is age 65 or older can qualify for Medicare. A patient who is age 65 or older can qualify for Medicare. A low-income patient may be eligible for Medicaid, so that's indigent. A low-income patient may be eligible for Medicaid. So if you're eligible for Medicaid, you're considered in verbiage indigent. Dependents of military personnel are covered by TRICARE. TRICARE is for military personnel. Surviving spouses and dependent children of veterans who died in the time of duty are covered by the Civilian Health and Medicaid program of the Veterans Administration, CHAMPA. It's CHAMP VA. Employees who are injured or become ill due to work-related issues are covered under workers' compensation insurance. Please highlight that if you're able to. Medicare. Medicare is a federal health insurance program that provides health care coverage for individuals who are age 65 or older, people who are disabled, and patients who have been diagnosed with end-stage renal disease. On your exam. So see if you all get these things wrong, I'm gonna come look for y'all, okay? I'm coming to look for y'all because I'm telling you all to highlight this. These things are on your final exam. Go through these things. This is what you definitely will have to know during medical billing and coding. Also,
I will highlight it when I get home. Because I can't
okay, I'm
do it
just
right
as
now.
long as you highlight it. Medical office assistant. You have to know these things. You have to know what is covered under Medicare. What is
Right.
considered, what is covered under Medicaid? What are the programs? You definitely have to know this, and this is on your certification exam once you finish the course. So remember, Medicare is a federal health insurance program that provides health care coverage for individuals who are age 65 or older, people who are disabled, and patients who have been diagnosed with end-stage renal disease, ESRD, end-stage renal disease. Medicare refers to those covered by Medicare as beneficiaries. Medicare currently is the world's largest insurance program. Not Medicaid, Medicare currently is the world's largest insurance program. So you know that's a true false, right? See how helpful I am? You see, that's a true false. So if y'all get that wrong, that's gonna hurt my feelings.
She's going to hunt us down, guys.
It's gonna hurt my feelings. Medicare, not Medicaid, not TRICARE, not CHAMP VA. Medicare currently is the world's largest insurance program. In 2017, there were more than 58 million beneficiaries. The Medicare program is administered by the Centers for Medicare and Medicaid Services, CMS. That's on your certification exam. Everybody that has taken it, that question has been on there. The Medicare program is administered by the Centers for Medicare and Medicaid Services, CMS, a division of the Department of Health and Human Services, HHS. Laws enacted by Congress regulate the Medicare program. Make sure that you review the comparing Medicare plans. Part A, monthly premium. You all have to know this. You have to know this as a medical billing encoder and a medical office assistant. Comparing Medicare plans. Covered services. Part A is inpatient hospital care, skilled nursing facilities, home health care, and hospice services. The monthly premium is $0. The deductible, $1,340 deductible for each benefit period. That has changed. This was in 2018. Day 1 through 60 is $0 co-insurance for each benefit period. Days 61 through 90, $335 co-insurance per day of each benefit period. You'll have this in a book, but you have to know it because they'll have it mixed up when it comes to the certification exam to know if you know the correct premium, which the correct premiums have changed for 2023. Part B, outpatient hospital care, durable medical equipment, provider services, and other medical service. So remember, you're going to have to know what Part A covers. Part A covers inpatient hospital care, skilled nursing facilities, home health care, and hospital services. Part B covers outpatient hospital care, durable medical equipment, provider services, and other medical services. Part C covers expanded inpatient hospital and outpatient hospital care benefits. Your copay varies by plan. Part D, prescription drugs. So that should be the easiest one for you to remember. Part D is already D for drugs. You know, Part A, so can y'all tell me, is that what does Part A cover?
Part A covers inpatient care. Hey, you just said it, and I'm like, my brain just went blank.
Home
Right.
health services. Home health services. No.
It depends. It depends on your insurance. So see, it's skilled nursing facilities, home health care. So that's at home, and hospice services. So inpatient hospital care, skilled nursing facilities, not just regular nursing care facilities. That's the difference. Skilled nursing facilities. B, outpatient hospital care, durable medical equipment, provider services, and other medical services. C, expanded inpatient hospital and outpatient hospital care benefits. D, prescription drugs. And then you can also log on and find it for Medicare. Medicare costs at a glance because the things have changed for 2023. So you can always go under the website to find those changes. So here it tells you, Part A covers inpatient hospital charges. It is financed with special contributions deducted from employed individual salaries with matching contributions from their employers. Due to these contributions and regular Social Security contributions, there is no monthly premium for Part A. Part B covers ambulatory care, including primary care and specialists. Beneficiaries are required to pay a monthly premium. Beneficiaries can visit any specialist without a referral for Part B. Part C is an option for Medicare qualified patients to turn their Part A and Part B benefits into a private plan that can offer some additional benefits. The private plan must cover everything that would be covered under Part A and Part B, And Part D is a prescription drug program offered to Medicare qualified individuals that require an additional monthly premium. Please review this in the chapter. And then you had your critical thinking. Jana Green is a Medicare patient who has Part A and Part B coverage. Will Medicare cover her office visit with a cardiologist? What % of the bill will she be responsible for?
Cardiologist.
She has
She-
Part A and Part B.
I'm thinking.
So go back.
Want to say
So what's it? Part A covers inpatient hospital charges.
mhm,
It is financed with special contributions deducted from employees' individual salaries with
Right.
matching contributions from their employers. Due to these contributions and regular Social Security contributions, there is no monthly premium for Part A. Part B covers ambulatory care, including primary care and specialists. Beneficiaries are required to pay a monthly premium. Beneficiaries can visit any specialist without a referral. So just with knowing that information and the part it says here, Jana Green is a Medicare patient who has Part A and Part B coverage. Will Medicare cover her office visit with a cardiologist? What is the answer to that question first?
Yes.
yes.
Correct. Yes. Then it says, what % of the bill will she be responsible for? So let's go back up to the chart. So monthly premium is $0 for Part A. Part B, outpatient hospital care, durable medical equipment, provider services, and other medical service. Monthly premium is $134. So Part A, her monthly premium is going to be 0. Part B, monthly premium is $134. 1A for 183 2018 plus 20% co-insurance for all medical services. So what would her bill be?
20%.
That's one of your daily assignments. So make sure that you all review that and make sure that you review that and put the answer. The fee schedule for Medicare Part B is determined using the RBRVS. This system consists of 3 parts: provider work, charge-based professional liability expenses, and charge-based overhead. So you're going to go through that part. You're going to read through your Medicaid, mandatory Medicaid benefits. In order to receive federal funds for Medicaid, each state Medicaid plan must cover the following services: inpatient hospital services, outpatient hospital services, nursing facility services, early and periodic screening, diagnostic and treatment, which is EPSDT services, home health services, physician services, rural health clinic service, federally qualified health center services, laboratory and x-ray services, family planning services, nurse midwife services, certified pediatric and family nurse practitioner services, freestanding birth center services, transportation to medical care, tobacco cessation counseling for pregnant women. Medicaid has to cover all of those services. And if you look in here, it says the Medicaid fee schedule is the lowest of all insurance companies. And it may not be in the medical's office financial interest to accept a large number of Medicaid patients. A provider who accepts Medicaid patients automatically agrees to accept Medicaid allowed amount as payment in full for covered services. So they do still have hospitals who only take a certain amount of Medicaid patients because they know they're not getting a full fee schedule that would be required by a private insurance company. Eligibility for benefits is determined by the respective states, but most Medicaid recipients also are some or all of the following: low-income families, qualified pregnant women and children, recipients of temporary assistance for needy families, which is TANF, TANF, individuals who receive supplemental security income, SSI, individuals who receive certain types of federal and state aid, individuals who are qualified Medicare beneficiaries, QMBs. Medicaid pays for Medicare Part B premiums, deductibles, and coinsurance for qualified low-income elderly individuals. Individuals in institutions are receiving long-term care in nursing facilities and intermediate care facilities. Then you have your government managed care plans, children's health insurance programs, routine checkups, which is state CHIP programs, which is little CHIPS covers routine checkups, immunizations, doctor visits, prescriptions, dental care and vision care, inpatient and outpatient hospital care, laboratory tests and x-ray services, emergency services. You all have to know which plans cover which as a medical billing encoder. And if you're doing medical office assistant, you have to know what the plans cover. So please review this and really make sure that you're understanding what each plan covers. TRICARE is a comprehensive healthcare program for uniformed service members and retirees and their families. Members of the National Guard, Reserve, and their families can also be covered under TRICARE. The TRICARE program is managed by the military in partnership with civilian hospitals and clinics. It is designed to expand access to healthcare, ensure high-quality care, promote medical readiness. All military hospitals and clinics are part of the TRICARE program and offer high-quality healthcare costs at low cost. TRICARE offers two types of plans: TRICARE Prime and TRICARE Select. So for my true false, I might say TRICARE offers three types of plans, true or false. That would be false. Why? Because it's two: TRICARE Prime and TRICARE Select. So make sure you understand and you're studying that as well. Comparing TRICARE plans. Make sure you review the plans that TRICARE covers. Civilian health and medical programs of the Veterans Administration, review that. Workers' compensation.
Hello.
Hi. Workers' compensation is an insurance plan for individuals who are injured on the job or become ill due to job-related circumstances. An example of a job-related illness would be mesothelioma caused by inhaling asbestos. That's the commercial. You hear that commercial on everything. Every commercial is talking about mesothelioma. So make sure that you know what's covered under workman's
Tell your daddy to fix it
compensation.
for y'all. Have a long week, y'all.
Next, we have private health insurance plans. Review that. Employer group plans. Read through that. Self-funded group health plans. Health insurance modules.
Well, hey, haven't y'all been eating? It's dinner time.
Okay.
You're gonna eat your
Can
dinner
you mute
before you get
yourself,
ice cream.
please?
No ice cream until after dinner.
Yes, can you please put yourself on mute? Thank you. Health insurance modules. There are basically two different modules of health insurance today: traditional health insurance and managed care organizations. Please highlight that. Review what is traditional health insurance, managed care organizations, models of managed care organizations, health maintenance organizations. And please review, it has on here, to be completed by primary care physician or outside provider. Pre-authorization request form. Please review this chart, figure 15.1. You will have one to complete. So please make sure that you review what is needed, what is supposed to be checked, review this pre-authorization request form. As a medical billing encoder or in that front office, you will be required to complete this form. Make sure you review all of the modules that they're showing you. Go through this whole little section: utilization management, pre-certification, pre-authorization. They give examples: participating provider contracts, contracted fee schedules. You would definitely need to know this as a medical billing encoder. When setting up a fee schedule, a healthcare provider considers three things: time, expertise, and services. In every case, healthcare providers must place an estimate on the value of these services. Fees for medical procedures and services differ from office to office based on the type of practice. An office visit with a family practice provider may cost less than an office visit with a specialist. That's why when you have to see a specialist, usually your copay is more. The medical assistant's role, and then they have health insurance identification card. When a patient is enrolled in a health insurance plan, he or she will be issued a health insurance ID card that supplies the following information: health insurance company, health plan type, subscriber identification number, copay amounts, health plan name, subscriber's name and covered dependents, policy group, health plan contact phone numbers. The medical assistant must be able to identify all of the information provided on the health insurance identification card. If you're a medical office assistant, you will be required to make sure all of that information is accurate. Here is an example for a sampling of different ID cards of common insurance companies. So make sure you look at these different, because they're different. These different types of insurance cards, but you have to identify all of that information that was stated. You have to verify eligibility. Verify member plan participation. A provider web portal for online health insurance. It tells you where you can go in to verify if they're still in that plan. They have disability insurance, life insurance, long-term care insurance, liability insurance, the Affordable Care Act. Pre-existing conditions make it difficult for Americans who did not work full-time or were self-employed to obtain health insurance. Read through the Affordable Care Act. And these are your closing comments. So, do we have any questions in reference to what we have covered? I know it was a lot. This is recorded for you to go back and review, but please, this is very important as far as your role as being a medical office assistant with that certification and a medical billing and coding. This information right here is very, very important because it goes back to all of the different insurance plans, everything that you would need to know as far as like the card you would need, the information you would need to cover, the different types of insurance plans, managed care plans. You have your health maintenance organizations, which is HMO models, retirees under 65, their family members and others with TRICARE, which is for the military. What Medicaid is, who is covered under Medicare. The different types of providers. You have Part A, Part B, Part C, and Part D. Comparing Medicare plans. Government health insurance plans, what it consists of and how do they provide this eligibility requirements. What are preventive measures, preventive care services that are covered? Benefits. So all of these things are covered in what you will be going through next. So do we have any questions before we close out? Let me stop sharing my screen.
Miss Barron, can I pop before you exit? Well, when everybody leaves.
Okay, 1 minute. Let me stop sharing. I need to take a picture of the screen for you all so I can have a picture and saying who did participate. So who asked for the question?
Tatiana.
Okay, sure, I'll stay on after. Does anyone else have any questions or concerns or anything related to your daily assignments, to your labs, your grading, or anything you might want to ask? Please go ahead and ask now. No one wants to talk to me? I kept you all long enough? I see you, Misty.
It's been a long day.
So this is a lot of information, but this is really, really important information for your career because this is what you're going to be doing. So please
And
pay
it's
attention.
going to help me because if I do get this job, you know, it'll help me with all of that information.
You have to know your managed care plans. You have to know what's covered under parts A, B, C, and D. You have to know the preventive care. This is information that you all will be actually doing. You have to know how to fill out and complete a pre-authorization form, all of this stuff. So I cannot stress enough. Please go back and read through the chapters. Please reference your PowerPoint slides. Pay attention to when we're doing lecture. If you have questions, please do not feel afraid to ask questions. This is why we're here. We only do lecture 1 day out of the week. So if you have concerns with assignments, if it's something you don't understand and you're able to jump on the Zoom class, this is your time. Please do not be shy. This is your time to ask. This is a class. I mean, you know, we have to communicate. Doing your job, you're going to have to ask your supervisor or manager if you do not understand what the questions are. If you don't understand your assignment, you're going to have to ask questions. So this is your time to voice your concerns, ask any questions you might have. And if, like you said, you want to stay on and ask me a question, if you don't want to stay on with the group, we can do that as well right now. So remember, read all of your emails, check them daily when you log on, before you log off, and most definitely look at your news and announcements. This is recorded. Once we get off, I will, it'll be later on, but I will upload it and send it to you all. It's going to be posted in the Zoom class. This will be posted in Zoom class. Sometimes I send it in the email, but a lot of people have been having trouble with actually seeing the actual video when I do it in the roster, but it is posted in the Zoom class. Check everything in your grade section. Your grade e-learning is where your information is. So if we don't have any other questions, you all have a great weekend. Stay safe. And Tatiana, you wanted me to stay on, correct? Okay, so if everyone else would like to leave, if you don't have any other questions, enjoy your weekend. I will be posting some videos for you all in reference to your Medicare Part A, B, C, and D for you all to look at and save and you know, just to help assist you. I will be doing that. I will be sharing that with you all tomorrow. I'll be sending that. And it also will be posted in your assignments. I do have videos in your assignments as well, and you will have videos posted in your labs. So pay attention to those. Make sure you're opening your labs. Make sure that you're opening everything in e-learning. I mean, I'm having people that are asking me questions, but you're asking me questions because you have not read. You cannot get away with reading without being able to read and building and coding. That's all you're going to be doing is reading, reading, reading. Everything is reading. So please, before you ask me questions, please make sure you have read the directions or read your emails or looked in your news and announcements before you ask a question. Because my older students know me, I will say, have you read? I sent it to you in an email. So that's showing me, I put it in your assignment. So that's telling me you didn't read. Hi, Misty. You remember I used to do you that, Misty?
I played the fifth.
And guess what? Misty, how do you say, look, she understood because you have to read. That's the only way. Read your emails. You know, please do not, I mean, sometimes you miss it. I understand, you know, sometimes we do miss things, even if it's in the email. I understand that. But do not ask me questions that if you have not read everything first. Make sure that you're reading first. So you all enjoy your weekend. Stay safe. And like I said, I will be sending you information. If you have any questions or concerns, remember, Monday through Friday, business hours, 8 to 5, Monday through Thursday, Fridays, 8 to 4. Please do not text me after 8 p.m. And do not text or call me on the weekend.
Unless it's emergency.
Unless it's an emergency. Assignments are not emergencies. If it's in reference to an assignment, please do not text me on the weekend. I want to enjoy my weekend as well as you all do. So please do not text me on the weekend because I would not respond. So thank you. I am staying on for Miss Tatiana. If anyone else does not have any questions, enjoy, and I will talk to you all later. Enjoy your day. Bye-bye.
Okay.
Miss Berry, how
Yes,
are you
ma'am.
today?
So do you want this recorded or you want me to stop recording?
I mean, it doesn't matter.
Okay.
But I was just basically asking. I missed some of the beginning. I was going to be like, how do I go back and look at it, because I was trying to do that when I was doing the lab.
Okay, so as I stated, it's being recorded. So once we're done, it's going to be placed. And once I convert everything, I will place the video in your grade section of e-learning. It's going to be placed in your Zoom class.
Okay.
So in the grade section of your e-learning, let me show you where that is. Let me share my screen again. You're going to go right here in this gray section. When you log in, you see where it says Zoom class.
Yes, ma'am.
You're going to click on Zoom class. This was the last one that I had for the last module. We were entering into this new module. So once I convert and I have everything, it'll be placed under here. This entire class that we had, everything that we reviewed and went over will be placed in this gray section where it says Zoom class. You'll click on it and it'll be right here in the section under Zoom class.
Okay, and you said we're going into chapter 3?
Yes, and in your daily assignment, let me go to your coursework. Coursework, today we're on. Today we have an exam. You're not responsible. So today, day 5 is the last day in chapter 2, because if you look right here under exams, today is the exam for chapters 1 and 2.
Okay.
So today is the last day in chapters 1 and 2. And if you look at the, let me go back to daily assignments for day 6, which is tomorrow, it says right here, day 6 of 16, daily assignment, chapter 3.
Okay.
So everything when it's covered is going to have the chapter. So we will be going in chapter 3 starting on tomorrow. I did a review of everything for chapters 1 and 2 and covered information in chapter 3. Legal principles.
Okay. Okay. See, yes, ma'am. That's what I was just trying to see, because I read the pages that you were saying read. So when you were going over some of the stuff, I'm like, okay, yeah, that sounds me, because I read. But okay, that's what I wanted, because like I said, I'm at work and I missed some of the call. That's why.
But you didn't. Look, you didn't,
later.
because it's going to be recorded, so you'll be able to go back and look at everything that we covered.
Okay, all right. Yes,
Yeah,
ma'am.
that's what I'm explaining to you. This, what we're doing
Right.
now is recorded. So when you go to review everything, you're gonna go to Zoom class, which is right here. And everything that we're doing now is recorded. So I'm gonna put the entire video that we went through, everything that I discussed, you'll be able to review in your Zoom class once I upload it into the system.
Yes, ma'am.
So you'll have everything. And then remember, tomorrow is your day 6, chapter 3.
Okay.
You're not responsible for the exam for chapters 1 and 2. And then on here is your labs. So your labs are due on it's Sunday. All labs are due on Sunday, but you're going to start on day 3 lab. Your day 1 and 2 will be dropped.
Okay, because I did 3, and 4 already.
Yeah, you're responsible for those.
Okay.
You're not responsible for day 1 and 2 labs.
Okay.
So those grades will be dropped.
All right.
You got it. If not, ask your questions.
Yes, ma'am, I got it.
So if you still are having difficulty, just give me a text. But remember, I do not respond after 8 p.m.
Okay. All right.
So you're okay?
Yes,
Let me
ma'am.
stop sharing. So you're okay, Tatiana?
Yes, ma'am.
Okay, so if you have any other questions, like I said, it's going to take time for this to convert. Once you'll probably get it like about 7 or 8 because it's going to take a while because it's been over an hour. So I'll send this to you. It will be in the Zoom class. So once about 7 or 8 check it, it'll be in your Zoom class.
Yes, ma'am. That'll be good because I'm still out here delivering packages. So yes, ma'am.
Yeah,
That'll
so you
be
have
right
all
on
night.
time
Look,
for me to get on.
once it's recorded, you can go 2 in the morning, 3 in the morning and watch it. It's in the system.
Yes, ma'am.
Yeah, if you want to watch it every day, it's
Okay.
there for you. It's
All
there
right,
for you.
that's
You want
fine.
to watch it
Okay,
every
that's
day.
cool. Okay, then. Thank you for your time.
Oh, you're welcome. And just remember, like, if you have any questions, give me a text or call, okay?
Yes, ma'am. Have a good one.
All right, enjoy your day.